sell today, tomorrow day. Auntie begin, Johnny leave you waka, but this load where you carry no be only you waka come. Forget the driver, the race is not to the swift. Take 'em slow and steady, your own passenger go enter. I hear where only lion. Et you got boo et your cheerful, cheerful, cheerful. To clap your go, cheerful, cheerful. Yeah, it's hope for tomorrow. Your morning has come. Cheerful, I see light, a new dawn. Oh, to drop your goal. Cheerful, cheerful. We will stop the hating, we will stop believing. Morning has come. Cheerful, one day I go blow, and you said you go know, you go come my show. Cheerful, someday, things go sweet as is sweet before. Cheerful, you go marry that girl, you go buy that big house. Oh, cheerful, cheerful, as you start this year, you go end them well. Oh, cheerful.
My name is Olatoye Ujo Baba Funke, LGA Supervisor for Breakthrough Action Nigeria TB Intervention. Tuberculosis is real. Everyone is at a risk of contracting tuberculosis. So, my sister, please check that cough. My brother, check that cough. Check the night sweat. Check that weight loss. TB testing and treatment is free at any primary health center. So please save your life and save the lives of those around you. Keep listening to Solutions Clinic on Solutions 93.9 FM. Thank you.
Junior, get inside. You don't want to let mosquitoes bite you, do you? Me, I cannot treat malaria again, no.
Mama Junior, children will play. It is you that should keep your environment clean in order not to breed mosquitoes.
Even after netting the whole house and sleeping inside the insecticide-treated net?
Of course. Don't you know the state of your environment is as important as inside your house? Yes. When you get rid of stagnant water at every space mosquitoes can breed, be rest assured, Junior can play all he wants.
My friend, the honorary doctor. I will do just that, so that my family can say bye-bye to mosquitoes.
Not just mosquitoes, but malaria.
Together, we can achieve a zero malaria society.
This message is from Solutions 93.9 FM.
Well, it's a beautiful Monday morning right here on the Remedy Dial Solutions 93.9, 20 minutes gone past the hour of 10. Welcome to yet another interesting edition of Solutions Clinic, where we get to talk about everything and anything health. My name is Vic Riches. Alright, this morning we're going to be talking about arthritis. Arthritis is a disease that encompasses over 100 different conditions. It is prevalent and often misunderstood in several medical conditions that affects millions of people worldwide. It's a group of disorders characterized by joint inflammation, pain, and stiffness, which can significantly impact a person's quality of life. In today's episode of Solutions Clinic, we'll delve into the world of arthritis, exploring its various forms, causes, symptoms, and the management options available to those living with this chronic and often debilitating condition. Joining me this morning for this conversation is our very own Dr. Chukwuma Okoli. Good morning to you, sir. It's great to have you join us.
Thank you. Good morning.
Trust you had a great weekend yourself.
As well, I did.
Awesome. So let's delve right into the conversation. How does arthritis present itself? How can we identify it?
Thank you. Arthritis, just like you have said, is a disease involving the joints. And it's quite common in the elderly, in the old age. Okay. And as a matter of fact, I used to say when people retire from active work, that's when arthritis surfaces. Some people, even while they're still in active service, the arthritis surfaces. Now, what does it mean? And that is, they wake up, the first thing is the joint pain. The next is the swelling, and then reduced movement or painful movement. It's common, of course, around the knee joint for most people. It's commoner in women than in men, and then it is worsened by menopause. So once menopause sets in, arthritis shows up. Well, there are links between those two. All right, and that's for women, the function of estrogen and progesterone, which maintains the body of the woman. So once menopause sets in, there is drastically reduced production of estrogen and progesterone, and therefore all the body parts are affected. A lot of symptomatology comes with menopause, and one of them might likely be, though it's not every woman will go through menopause, but not every woman will have arthritis, and that's just because arthritis is an incidental event happening not to all women, but every woman will go through menopause, as it were. And so there is the pain, there is the swelling, and there is painful movement or reduced movement. That is some level of joint stiffness in them. And then for those who are fair-skinned, it could be reddish. The joint part could be reddish in color. So those are array of symptoms that has to do with arthritis that is common in this part of the world.
Fair enough. You've mentioned a couple of things. The age group is peculiar with the gender who would most likely come down with it more. But I also, at the course of my research, I saw that even young people, children between 2, 3, 4, teenagers, there's a type of arthritis that they come down with. Can we get clarity on that?
Thank you. Aside from the fact that it's commoner with old age, we also have autoimmune condition that causes arthritis. Yes, and autoimmune means that a particular part of the body is being attacked by the immune system. Yes, that's failure of recognition, like I would say. Yes, when the immune system suddenly does not recognize somebody's hand, and then the immune system starts attacking tissues of the hand, and the hand will wear off and possibly die off. So it's commoner in younger generation where they have autoimmune condition. We have rheumatoid arthritis and so on and so forth, which affects their joints, affects also their heart valves. It's common in children. It's also found in adults. So for those it happens, that's most likely the cause. It's not common to find arthritis of the geriatric type happening in children. That is, a 20-year-old having arthritis just like an 80-year-old. It's not common, though in medicine we say never say never. Anything is possible.
Is there a cause for this immunal failure that leads to arthritis?
Okay, just like I said, the immune system suddenly fails to recognize a particular part of the body.
Just like that.
Yes, it's autoimmune, and
Hmm.
when it happens like that, you just have to. The cause is majorly unknown, so you have to manage the situation when it starts.
Is there a particular part of the body that it targets, or it's just every part of the body that has a joint?
No,
That
of course,
feels-
the hand, the knee, the hip, and then the heart valves. That's for rheumatoid arthritis. It takes out those parts of the body.
All right, you're listening to Solutions Clinic right here on the Remedy Dial Solutions 93.9 FM. We're talking about arthritis this morning. So if you do have questions in that regard, we're streaming live on Facebook as well as YouTube at Solutions 939. So do also jump in on these platforms and send in your questions. You could also take advantage of our WhatsApp or regular message line, which is 0904 422 2939. So you can send in messages with that number if you have questions at arthritis or you know someone who is dealing with it. I think this is the best time to reach out to them to tune into the Remedy Dial to listen to the program. All right. When people have arthritis of the finger,
Yeah.
is that what leads to deformity?
Yes. Yes, it's possible. Of course, yes. In fact, the deformity part comes with when most likely if it's autoimmune, then the tissues are now destroyed and then it will malform. Yes, it will malform. I saw a picture online while I was just going through. Okay, look at this now. You can see that
Wow.
doesn't look like a normal hand.
Wow.
Yeah, so arthritis.
The rashes on the hand, is that part of it?
It's also part of it, yes. So the hand is obviously deformed or malformed, as it were, exactly, as a result of the ailment. So that's part of the symptoms.
This is crazy. So what are the modifiable risk factors that we should pay attention to? Since there is no known cause, as it were, is there something we can do to ensure that, particularly for women who are more susceptible to coming down with it?
Well, risk factors are not so common in this discussion, this topic we are having. The only thing that has been mentioned so far is smoking. Okay, aside from that, lifestyle is also mentioned as modifiable risk factors, lifestyle. Okay, yes, obesity, okay, and then, of course, like I used to say, by the time you're weighing about 115 kg and you're just maybe 20, 30 years of age, and you're already like heavyweight champion in terms of weight, then you know what will happen by the time
Is it possible to be weighing so much and it's not showing?
Yes, it is. Let me use
So someone
myself.
can look like me and is weighing over 100.
Sure. Yes.
There's a problem.
Yes, the bones and muscles. Yes.
So is that where the fat lies?
No, it's not
Oh,
fat.
okay. Okay,
Fat
that's not
doesn't
fat.
weigh. It's bones
Oh,
and the
okay.
muscles and then the fluid in the body.
Is that a good thing?
Of course, yes.
Okay, fair enough.
Yes. For me, I'm weighing about 115 kilograms of weight.
Okay.
Yes, and I work out every day, and
Wow.
I don't eat just anyhow. I've tried to fight it. I tried starving. I tried reducing. When I dropped less than 109, I started feeling dizzy. Yes, feeling dizzy. So my blood PCV dropped to 38, and I knew I had starved myself too much. I had to start eating again. So at the end of the day, I eat 1 to 2 times. Like I mean 1 to 2 times. Yesterday I ate just once. And it was even half chop, so to speak. Madam was complaining so bad about the half chop. And then this morning, when I got up, as I was dressing up, I went to the weighing scale and it was 115. And I was like, well, at this juncture, I just have to continue. Probably if I stop working out, maybe I can drop the weight, maybe.
So let's talk about exercises. I've heard, I saw a question, someone saying, does excessive exercise trigger arthritis? In the sense that, you know, you strain so much that you start experiencing some sort of pain, you know, or you break a joint at the point of doing some very strenuous exercise. Will that in any way trigger arthritis?
The issue I have with that is I would rather say lifestyle, in that for teachers and for those who spend hours standing, walking around, they overuse the joints. We've seen people come up with arthritis of the hand from result of writing. You now realize that for 30 years they've been writing on the board 6 days a week. Yes, 6 days a week for 30 years. At the end of the day, wake up one day and notice the hands, the joints are, swollen, painful. You notice that arthritis has set in. So, exercise, yes, has its own advantages and disadvantages. The problem I have with that is for people involved with deadlift, when they have to lift very heavy, unimaginably heavy loads. Like you can imagine lifting up to 1,000 kg weight. That's like lifting a Micra vehicle up, and that's what they do. Such can actually wear out the joints, the hip joints, the knee joints, and all that. So that are ways that such joints can be worn out, and then arthritis can develop from such activity.
Okay, fair enough. At least we have an understanding that it's about what you're carrying, not necessarily involving in exercise. But I think exercise would, in its way, help.
Yes,
you.
it's part of the recommended treatment options. Yeah, physical therapy, bracing, joint replacement for those that are quite severe. Then we have the oral medications that can be used to help, tablets that have been prescribed after proper examination and diagnosis.
Okay, speaking of treatment options, I want to understand the impact of physiotherapy as it concerns
Very well.
arthritis.
Arthritis, physiotherapy is in fact very much useful. Very, very useful. I know a couple of patients I've referred to very competent physiotherapists around me, and the patients have done so well. They've given feedback that is absolutely fantastic as to how they have improved tremendously from the physiotherapy. So yes, physiotherapy is highly recommended. But of course, one beautiful thing, I have a friend who is a very close friend who is a physiotherapist, and what he'll tell you is, even if you walk up to him directly and say, hey, I have this, I have that, I want therapy, he will say, okay, please, can you see the doctor? Now, the doctor will examine you and then send you for necessary x-rays and radiological imaging of the body, MRI, x-rays, and those that are needed, and then proper diagnosis is done. Then, in places where oral medications are needed, it will be given. Then, at that point, you now send back to the physiotherapist to continue from there. The results are always tremendous.
Okay, let's talk about. I've seen a couple of recommendations, for arthritis. I've seen the kale vegetable. People suggesting that. People saying using turmeric. I've seen two. Why is your face like that?
Well, all those things are good.
Oh Lord. Yeah, so I've seen that. So someone was sharing a testimony on Twitter the other day of how her aunt was down with arthritis, and they did a turmeric solution, blah 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 blah. And people have unique experiences.
Yes, we've seen people use such medications, and we've had good testimonies. I would say, well, what goes on for the goose might not be the same.
Right.
Exactly. So it might not work in all situations where you would say, oh, please abandon. No, that's a crazy part. When you say, hey, abandon that doctor's prescription and go and get this leaf, go and get that leaf, mix it together. It worked for me. It will work for you. Lest I forget, those herbs are not tested. Your kidneys are, by the way. Just remember them before you start swallowing those things. You don't know the impurities in them. Exactly. So it's best to say, just stay with the doctor's prescriptions, and you'll be fine after all.
Inflammation is said to be, a chronic diseases that include indigestion.
Which one?
Inflammation, for instance, is somewhat related to indigestion of food. I suppose.
No, inflammation is actually swelling.
Okay.
Now, swelling of the body parts. Okay, depending on which of the part of the body involved, and inflammation is found in almost all disease conditions. Or in fact, it is in arthritis. As a matter of fact, it's the inflammation that leads to the pain. Yes. Those are five. It's found in almost all disease conditions, And that's why one of the things you manage in those disease conditions is reduce the pain as well.
How do you do that for the swelling?
Sorry,
How do you reduce that?
Okay, now, of course, you give we have medications that are anti-inflammatory. We have most of the analgesics rather are anti-inflammatory. Okay, and then they are analgesic as well. For instance, when paracetamol, okay, it reduces the pain. We have some other generic names that are common, okay. Diclofenac, once you take it, it reduces the swelling. It will eventually reduce the pain, whatever brand you buy. It's the generic name. Okay, so once you give those analgesics, they reduce the swelling and eventually reduce the pain. Though it's not in all cases that the swelling is perfectly reduced. You might actually need anti-inflammatory medications that are directed towards reducing the swelling. Okay, the goal is
Redemption from that phase.
Thank you. Well, we can't say which one will eventually turn out nice, but what I would say is let's attempt to manage all cases that present. From this one, it doesn't look good. The prognosis does not look good because that hand is already deformed. Of course, give pain reliefs and then channel them to physiotherapy and trust God for the remaining process.
But before getting to that stage,
Yes.
because I've always noticed that during the course of our conversation, early presentation to
Yes.
any kind of disease
Yes.
is the fastest way to
Exactly.
healing.
Of course, yes.
So, what were the signs that were ignored that led to that severe case?
Thank you. Well, people know how to manage pain and painful movement until when even some people will still manage this early swellings and redness of those particular joints until when movement is extremely difficult or not possible at all. That is the point where they
Is
get
it
to the
possible
hospital.
not to arthritis leading someone to not working?
Yes.
Oh, wow.
Yes, it can cause excruciating pain that will make movement in its slightest form very painful for such persons, and at that point they may need to even be carried to the doctors. Yes, so if once they present early, like you notice an unusual pain in the joint, and of course irrespective of the age, before you jump down to the doctor's office, do your first aid, and having done the first aid you don't see an improvement, then messaging doctors and saying this and that is happening, my place is far, text. I think instead of this that I'm thinking of, I need to do that, and then changing my style of management has achieved more success than I would even sometimes be thanking God I did not send the initial drug I wanted to send. It will create another scenario entirely. We need to sometimes review, and we've seen cases where we have said, oh, this is what is happening, and that, and everybody's fine. So it's always
22229 on the impact of, I already mentioned the impact of physiotherapy, and it brings me back to if it's important that we have scheduled visits to the physiotherapist, especially for aged people. I mean, it's not very common in this part of the world. The fact that it's very common or likely for people who are, aged to come down with it. It's safe to say that you should have scheduled visits of that.
Thank you very much. Yes, you should have scheduled visit. I was speaking with a physiotherapist friend, and then I asked him how the practice has been so far. And then he said around the location of his practice that we have more people turning out for physiotherapy because they have also understood that you have to stay pro-health. You don't wait until you come down with ailment before you go for treatment. And a lot of people they believe that when they do physiotherapy, of course, it helps them recover various parts of their body they had difficulty managing while they were ill. So you don't necessarily need to wait to be down. You actually at times have this mentality of checkup. The essence of checkup is to be sure everything is fine. So when you are checked properly, then you don't need to fall sick again, because you know that you will be told things to do to stay healthy. That's the goal, staying healthy, not recovering from ailment. It is better to stay healthy than to get treated and recover from ailments.
Fair enough. We have a question here, and this is from Ty, and he says, I've heard that... what's this? Okay, I've heard that cracking your
Right.
causes arthritis.
It does.
It does.
Yes. And also
It does.
Yes, I'm also involved. I do that a lot. So
Are you serious?
Yeah. Yeah.
Wow.
Mhm.
How?
Okay. When you keep cracking it, then it becomes freer, looser, and then a bit more
Oh
painful.
my God.
Yes.
Thank you for that question, because this is something I do almost every now and then.
Yes. Now the parts that it's now this is it's a bit sensitive thing to ask. Now intentionally cracking your fingers and all that can cause arthritis, but sometimes some people do present with headache from malposition during sleep, so you might need to turn their necks to certain parts to free up that stiffness, because stiffness in itself can cause headache. So in such people, once you help them and then you twist the neck, you hear the crackle sound, but they'll tell you, I feel better. The headache has gone or reduced drastically. It's different from intentionally pulling and then, and as a matter of fact, I crack mine to the extent that I used to crack it like this and like that and to be making sound.
Wow.
And
Yes.
after a while, I will not start having pain in the joint. So I stopped crackling it for like a month and the pain disappeared, and I'm like, I won't do that again. So I forced myself to obey.
Funnily, there's no discomfort whatsoever. We just enjoy. I think it's just the sound that gives. Because I'm just thinking about it now. I don't think it was the time I was feeling any form of discomfort.
Okay.
You just want to.
Well, we are all different. We do as I do my. I read a lot. So while reading, I'm always doing it. As a matter of fact, if I should, pull my tongue and do the neck, you'll be shocked at the sounds you hear. I do that almost all parts of my body. Probably after working out, I want to free myself, so I do a lot of crackling sounds. But now I'm learning to stop them, because I kept having pains. In fact, to the extent that I'll be having pains in my fingers, the 8 of them. Yes, and then I'll get an analgesic and be applying. And one day, the voice just said, "You keep applying pain relief while you are the problem." And I listened further. So what's the problem? You keep cracking your hands, and that's why you're having pain. And then I stopped cracking it. And when I stopped cracking the hand, the pains reduced drastically. So I stopped completely.
I want to ask about these people who do this whole cracking. I've forgotten the name they call them.
Is it chiropractors or?
Yes.
Yes.
Chiropractors.
Yes.
Is that safe?
Yeah, that's different. That's why I said it's different.
Okay.
Now, they do therapeutic ones. Okay, like I said, sometimes due to malposition, we sleep in odd ways. Man, people now understand about sleep hygiene. I was talking to a friend this morning, and he was telling me about the sleep hygiene. He even talked about the fact that he noticed that in the past few days, his deep sleep has been very reduced, probably just an hour. The remaining parts of the night he's awake, not so well, and I felt like, oh, that's not good. But at least he was able to diagnose his sleeping difficulties, and we decided to look into it together. Same with this chiropractors. This is what they do. Therapeutically, while people sleep, they assume odd positions, and then they wake up with body pains. Okay, some it's the bed they use in sleeping. They use overtly soft beds. So once they lie down, the body assumes a particular shape as a result of the folding in the bed. And that after some hours, they will have pain. Whether they sleep face to the bed or they sleep facing up, they will definitely have pain. So when you get to the chiropractor, he will help restore the normal anatomy of your body. So it will give crackling sounds, but it will give you a relief because you have wrongly slept in manners that caused pain for you. That is different from that's not the same. They're not the same.
That thing is scary. You're just looking at it. It's actually very scary. All right, the question here, this is from Moses. It says, I'll be 47, but I'm a dancer.
Wow, lovely.
And dancing is what keeps me going. But 20 years ago, I had an injury, arthritis in my feet, and it almost led to the demise of my career. So I taught, but I recovered and I continued dancing. Well, mindset about it changed and I became better. But I'm feeling that right now that I'm 47. I'm feeling a lot of weakness in my feet. And honestly, I still feel very energetic and I want to continue dancing.
Yes. Thank you very much, sir. I would say from the bottom of my heart, I am rooting for you. I am in support of you 100%. You know what to do? Get to the gym. Get a gym instructor. And then continue what you do. Don't stay back. 47 is just a number. We're in the same age group, bro. And trust me, when you come near me, I will lift you up. Yeah, I'm very sure of it. Unless he's weighing 200 pounds.
I'm sure it's not.
So please don't give up. Continue what you do. I'm with you all the way. Continue. Just get a gym instructor, and then you will work. Most of those gym instructors they study this physical education and all that, so they also know a bit about physiotherapy. And then if it's so painful or so heavy, get a physiotherapist. He will rehabilitate that leg or those legs, and you are back on your feet dancing. Don't stop. Probably until you're 100 years. Don't stop. You're 47, not even 50, not 60. Please continue. Thank you.
I mean, I think that's the motivation we need for this Monday. Look at the likes of Kate Henshaw. You know, still, I'm in awe anytime I see her doing what she does.
Every time I see her, I'm like, this baby's older than Nero. And
Telling
she's working out. I'll be like, auntie, yeah, I can't join you.
I'm telling you, I'm always in awe anytime I see her doing what she does. Oh, well, this has been quite an interesting conversation. Your final words on arthritis as we conclude this morning.
Yeah, arthritis, of course, a lot of our old people are already down with it, okay? And I would say I wish them well. Please continue your medications. Don't feel you are tired. Please visit your doctor and let your doctor reassure you. If you feel those medications are not working, there are all alternatives always. So don't stay back and say the drugs are not working, I'm not going anywhere. Please get up, get help, and you can still have your life back. Arthritis is not a death sentence. Arthritis does not kill. It is not deadly. Just manage it well. Have a positive attitude to it. No matter the ailment, people recover. If cancer patients are recovering, organ failure patients are recovering, how much more a disease of the joint? It can't stop you. You can live your life to the full, irrespective of that. Stay positive, because once your mind is strong, your body will respond. That is how I woke up this morning. Thank you.
Thank you very much, Doctor, for such insights that you've shared on arthritis this morning. I'm sure this few minutes that we spent together has been very rewarding for you listeners. Thank you very much for your questions as well, and for always tuning into Solutions Clinic. We'll be back next week, Monday, for yet another interesting conversation on health. Like I would always say, a healthy life is your ticket to a wealthy life. My name is Vic Riches. Have yourself a blessed Monday.